Good morning, everybody. My name is Antonia Anoloha. I'm a DMP student from Brandman University. I'm in the class of Dr. Clary, NURU 641. I'm here to present teaching tool for Lamatrogine. What is Lamatrogine? Lamatrogine is a mood stabilizer medication that works in the brain. It is approved for the treatment of mood swings in people with mood disturbance and prevent reoccurrence. It is also for the treatment of seizure disorder. How to take Lamatrogine? Lamatrogine is usually taken 1 or twice a day. You can take Lamatrogine with food or without food. The provider will start you with a low dose of the medicine and slowly increase the dose for several weeks. The dose ranges from 25 mg to 400 mg, and only the healthcare provider can determine the correct dose for you. The important information one should know about Lamatrogine. Mood disturbance requires a long-term treatment. Do not stop taking the medication even when you feel better. Missing doses of Lamatrogine may increase the risk for relapse. Do not change the dose without talking to your doctor. There is no problem associated with long-term use. Notify your healthcare provider if you are planning to get pregnant. What to avoid while on Lamatrogine? Avoid drinking alcohol and avoid using illegal drugs, because alcohol and illegal drugs may decrease the benefit of the medication and increase the medication side effects, such as sedation. What to do if you miss a dose of Lamatrogine? If you miss a dose of Lamatrogine, take it as soon as you remember, unless it is closer to the time of the next dose. Do not double the dose or take more than prescribed. Contact your healthcare provider if you miss more than 3 days of the medication for dose adjustment. Side effects of Lamatrogine. Common side effects of Lamatrogine include weight loss, dizziness, drowsiness, diarrhea, constipation, loss of balance, eye movement that you cannot control, trouble speaking. The rare severe side effects include rashes. So if you notice any rash or you have a suicidal thought, please report to your healthcare provider or go to the emergency room or call 911. This is the end of my presentation. These are my references. Thank you. Questions, comments, and suggestions are accepted.